Plant-based foods have chemopreventative properties. They have the ability to block progression of latent microtumors because they have a high content of phytochemicals, which create hostile environments for tumor growth, and they act directly on the tumor too. Bellevue and Greengus stated, preventing cancer by blocking development of these precancerous cells is extremely important because even healthy people have a certain number of latent tumors in their tissues. 98% of people who died from non-cancerous related causes were found to have latent thyroid tumors. Proof of these chemopreventative properties come in several hundred studies, including case control and prospective epidemiologic studies. They are then strengthened by evidence from animal and lab studies. There is an inverse association between consumption of fruits and vegetables and risk of cancer. 80% show a substantial decrease in risk with higher intake of at least one vegetable or fruit category examined. Plant origin foods include fruit, vegetables, whole grains, legumes, nuts, seeds, and tea. All vegetables showed 80% of decreasing cancer risk, and all fruit showed 64% of decreasing cancer risk. These diets are particularly true with cancers involving the upper GI tract. Cancer can be caused by many different sources, but three of the most common causes resort back to genetics, lifestyle, and environment. In regards to genetics, some DNA contains cancer-causing elements. For example, breast cancer can be caused by the BRCA1 or the BRCA2 genes. Additionally, DNA may undergo genetic mutations. These mutations can be inherited or acquired. Furthermore, certain nationalities are at a higher risk. For example, African Americans are at a higher risk of colorectal cancer in comparison to all other racial or ethnic groups. Lifestyles play a huge role with cancer prevention. Lack of exercise and poor diet increases the risk of cancer, so it is important to participate in exercise and eat well-balanced, healthy meals. Cancer can also be caused by smoking and tobacco. Smoking accounts for 30% of all cancer deaths and 80% of lung cancer deaths. Smokeless tobacco contains approximately 30 cancer-causing chemicals. The most harmful of these chemicals are tobacco-specific nitrosamines. Going hand in hand with diet and exercise, obesity increases cancer risks. The environment also has cancer-causing elements. Many elements have carcinogens, such as pollution and hormone therapy medications. Additionally, too much sun exposure leads to too much UV light exposure. This is a main cause of skin cancer, like melanoma and basal and squamous cell skin cancers. Similarly, too much exposure to radiation like X-ray, gamma ray, and radon can increase these risks as well. The progression of cancer is broken down into stages. A stage refers to the extent of the cancer and if it has spread. Knowing the stage of your cancer helps your doctor understand how serious it is and your chances of survival. Plan the best treatment for you and identify clinical trials that may be treatment options. There are many different types of staging systems that are used to classify cancer. The most appropriate staging system depends on some stage determining criteria. This includes tumor location, tumor size, cell type, spread of cancer, and tumor grade. The most widely used cancer staging system is the TNM staging system. Most hospitals and medical centers use the TNM staging system as far as their main method for cancer reporting. So anyone who plans to work on the oncology units, this is definitely a system you would like to know. In the TNM system, the T refers to the size and extent of the main tumor. The main tumor is usually referred to as primary tumor. The N refers to the number of nearby lymph nodes that have cancer. And finally, the M refers to whether the cancer has metastasized. Metastasized means that the cancer has spread from the primary tumor to other parts of the body. When cancer is described using the TNM system, there will also be numbers for each letter that give more details about a specific case of cancer. For example, you may see something like T1N0MX. The T1 denotes the size and extent of the main tumor. and 0 indicates there is 0 cancer found in the nearby lymph nodes, and MX indicates that the metastasis cannot be measured. These complicated groups of letters and numbers can give a great amount of detail into the cancer progression, but usually are detailed in 5 less detailed groups. This is what we commonly hear when cancer is discussed with our doctor or nurse. Stage 0 can be associated with abnormal cells that are present but they haven't spread. This can be referred to as carcinoma, which is not cancer but can become cancer. Stage 1, 2, and 3 are stages where cancer is present. The higher the number, the larger the cancer tumor is and the more it has spread to other tissues. The last stage is stage 4. This is where the cancer has spread to distant parts of the body and treatments become very difficult due to the wide spread of cancer and the effects it has had on the body and the organs. While the TNM staging system is most commonly used, other staging systems are used for different cancers that have a more applicable staging system. Examples of cancers with different staging systems include brain and spinal cord tumors, as well as blood cancers. The most appropriate treatment plan depends on the type of cancer you have, how advanced it is, and also takes into account your own personal beliefs and values. As we strive to practice holistically, healthcare providers may also use precision medicine to choose treatment options. Precision medicine is personalized medicine that bases treatment off of genetics and individual history. The process of cancer treatment can be overwhelming and grueling. The first step to tackling treatment is learning about each type of treatment and asking questions with your healthcare providers. The first type of cancer treatment is surgery. This is a procedure in which a surgeon removes cancer from the body. This may be open or minimally invasive based on the progression. The second type of treatment is radiation therapy. Radiation therapy uses high doses of radiation to kill cancer cells and shrink tumors. This is done by damaging the DNA in the cancer cells. Damaged DNA stops dividing and eventually die. This type of treatment is not instantaneous and requires days or weeks of treatment before cancer cells are damaged enough to die. Another widely known type of cancer treatment is chemotherapy. Chemo uses drugs to kill cancer cells. It works by stopping or slowing the growth of cancer cells and can also be used to ease cancer symptoms. Chemotherapy is often combined with other forms of treatment because it allows for other treatments such as surgery or radiation to have better results. Other types of cancer treatments include immunotherapy, which helps your immune system fight off cancer, targeted therapy, which targets the changes in cancer cells that help them grow, divide, and spread, hormone therapy, which slows or stops the growth of breast and prostate cancers that use hormones to grow, and finally, stem cell transplants, which are procedures that restore blood-forming stem cells in cancer patients who have had theirs destroyed by high doses of chemotherapy and radiation therapy. Individuals with cancer have increased nutritional needs for energy, protein, vitamins, minerals, and fluids. These needs will be highly individualized based on body response and the type and course of treatment. Both the illness and the treatment can affect an individual's appetite. Cancer and cancer treatments can also affect the body's ability to tolerate certain foods and use nutrients. So, eating the right kinds of foods before, during, and after cancer treatment can help the patient feel better and stay stronger. A healthy diet includes eating and drinking enough of the foods and liquids that have important nutrients that the body needs. These foods include beans, chicken, fish, meat, yogurt, and eggs. They should also include extra protein and calories. Nutrition therapy is used to help cancer patients keep a healthy body weight, maintain strength, keep body tissue healthy, and decrease side effects both during and after treatment. When the head, neck, esophagus, stomach, intestines, pancreas, or liver are affected by cancer treatment, it is hard to take in enough nutrients to stay healthy. Cancer and cancer treatments may affect taste, smell, appetite, and the ability to eat enough food or absorb the nutrients from the food. This can cause malnutrition, which is a condition caused by a lack of key nutrients. Eating the right amount of protein and calories is important for healing, fighting infection, and having enough energy. The nutritional assessment for cancer patients is extremely important. Key points of this assessment include the healthcare team asking questions about diet and weight history. Then counseling and diet changes are suggested to improve the patient's nutrition. The goal of nutrition therapy for patients who have advanced cancer depends on overall plan of care. Screenings are used to look for health problems that affect the risk of poor nutrition in cancer patients in conjunction with physical exams. Some subjective data questions that can be gathered during a nutritional assessment include: what weight changes have you experienced over the past year? Have you noticed any changes in the amount and type of food you're eating? Have you experienced any issues that affect your diet, such as nausea, vomiting, diarrhea, constipation, mouth sores, dry mouth, changes in taste and smell? Nursing interventions for cancer patients need to be holistic, similarly to any other disease treatment. Evaluating mental health status is extremely important due to the severity that cancer can have on a patient's life. A multidisciplinary team works together with the nurse to check on a cancer patient's nutritional, physical, and mental health during cancer treatment and recovery. This team could potentially be comprised of physicians, dietitians, social workers, psychologists, and mental health counselors. It is important for all team members to collaborate with each other and consult the psychology team if it is needed. Nurses have a special role in the fact that they spend a lot of time with the patients and should be able to better assess a patient's physical and mental status changes. This holistic approach to helping patients through cancer and recovery will yield better health outcomes. Interventions also include administering medications when needed. This could include chemotherapy or pain regulation medications. It is important for nurses to make cancer patients feel as comfortable as possible. Examples of this include regular feedings with food that the patient expresses they like, bringing blankets and pillows for physical comfort, and occasionally lending an open ear or hand of comfort when the patient needs to vent or cry. Every intervention should focus on treating the body, mind, and spirit. It is important for nurses to provide cancer patients with education and tools that they can utilize in dealing with disease, treatment, and recovery. The National Cancer Institute is one of many organizations that provide a plethora of brochures and information on cancer and its progression. It gives important information in easy-to-follow language and question and answer forums on certain cancer topics. It is also important to recommend support groups and events in the community that support cancer patients and their families. These support groups have a huge impact on cancer patients' outlook on life and make them feel that they are not alone. These sessions allow them to vent and help them in developing coping mechanisms and skills needed to be independent. Family sessions are equally important because families are usually the people that make up a cancer patient support group. They're seeing a loved one go through a serious disease that could potentially be terminal or alter their lifestyles forever. This could be traumatizing for the family, and they must be able to develop their own coping mechanisms and ways to deal with the effects of the cancer. Although it's a challenging subject and a very serious disease, nurses must explain the importance of adherence to treatment regimens and an appropriate diet. A nurse must explain to their patient what their good choices and decisions will improve, which is better overall health outcome. False reassurance should never be provided to the patient, but the benefits of adherence should be stressed and explained thoroughly. Ways to ensure adherence include wellness checks, routine blood work, physical and mental health exams, and confirmation that the patient has a concrete understanding of what is expected of them and skills to cope with recovery and potential remission. Cancer can happen to anyone, but to help decrease the risks for it, a nutritious diet and nutritional therapy are extremely important. Thank you for watching.